Racial disparities in women's health. Issues to discuss. The race of women in the U.S. plays a very large role in their health. Black and white women in the U.S. have completely different survival rates when it comes to certain diseases and illnesses. There are some major diseases that certain racial groups are more prone to getting. It has not been biologically proved that this is because of genetics. Instead, it is because of their environmental conditions that may contribute to these differences. How socioeconomic status plays a role in women's health. Healthcare coverage, government efforts to fight racial disparities in healthcare, and history of healthcare regarding racial status. Statistics of racial disparities in healthcare in the United States. Some of them are 45 million Americans do not have health insurance. African Americans are more likely than other racial groups to develop cancer and 30% more likely than white people to die from it. Hispanics living in the U.S. are 50% more likely than white people to suffer from diabetes, and the incidence of diabetes among Native Americans is more than twice for whites. Asian Americans and Pacific Islanders only represent 4% of the U.S. population, and they suffer more than half of the nation's chronic hepatitis B infections and half of the deaths from it. The main reasons for these disparities are toxic environments, low education levels, unsafe working conditions, and unemployment. Two major causes for disparities in the U.S. are low quality care and lack of access. Of the 45 million Americans with no health insurance, minorities account for half of that. Even when they have health care, they are less likely than whites to receive the appropriate health care. Statistics of racial disparities in healthcare in Canada. It has been shown that racial disparities are much less prominent in Canada due to their universal healthcare program. This shows that healthcare coverage for everyone can limit the disparities. The main disparities in Canada's healthcare are with immigrants who are less likely to have a main healthcare provider. Similar to the US, the country lacks public data about Black people's health. Some of the government's efforts to improve racial disparities in the U.S. are in the 1940s, Meidels and American Dilemma talked about the lasting effects of slavery. It wasn't until 1985, this because of a national issue when report of the Secretary's Task Force on Black and Minority Health came out, and it showcased the disparities between blacks and whites. In the 1990s, under Bill Clinton, many initiatives were launched to address these disparities. In 2000, the Minority Health and Health Disparities Research and Education Act created a center that mandated that research must be done on minority health and it must be reported on. Some of the government's efforts to improve racial disparities in Canada include the CPA acknowledging its role in maintaining proper healthcare for its citizens. The CPHA has admitted to the following. The Indigenous Relations Advisory Committee has been established to guide transformations that includes Indigenous people in their work and its public health advocacy. Some goals for the United States include healthcare for all, more education on disparities, more research on mortality rates for minority women, and language services. Some goals for Canada include to formally condemn racism, accept reviews for their policies and practices, remove racist procedures and practices, provide anti-racism and anti-oppression training for all healthcare workers, and improve their race and ethnicity data. Some major effects that these disparities have on women include the fear of getting treatment due to the past evidence of unethical treatment to minorities. Women minorities who become pregnant can have a hard time feeling comfortable with an OBGYN. Women can be emotionally and physically draining. It could be emotionally and physically draining on women who feel they will not be able to go to the doctor if they feel they have a serious health issue. And it can also have an effect on women who are in need of transplants because evidence has shown that they are not always the first priority.